The box was sitting on my desk when I came into my office. There was a flowery smell wafting from the box and a card sticking out of one of the slots. The card was typed and read, "I'm still here 10 years later, and for that, I thank you." I read the words and tried to imagine who would have taken the effort to find me. I read the name, and a broad smile formed as a tear simultaneously came to my eye. It was a former patient of mine, I'll call her Amy, who I diagnosed with primary metastatic breast cancer in her late 30s. A devastating diagnosis at any age, but an impossible diagnosis to fathom when one is single and in the prime of one's life. I had not seen her in 8 years, but her face immediately came to mind. There are some moments that are equally meaningful to clinician and patient, and my experience with Amy was one of those moments. It was 2012, 7 years after the approval of Herceptin, a first-of-its-kind targeted antibody used to treat a specific type of aggressive breast cancer called HER2-positive disease. Prior to Herceptin, HER2-positive breast cancer was a death sentence, with an average survival of only 2 years. There was simply nothing that was effective to treat it. Amy sat before me, tears in her eyes, asking me if she should be getting her affairs in order. I recall looking back and saying no. With such conviction, she believed me. And with each passing scan showing a rapid response, I was able to watch the fear that had gripped her slowly wash away. And I couldn't help but wonder, what if? In 1998, my mother noticed a bruise on her breast when I was a third-year medical student. Back then, genetic testing wasn't commonly offered, and though her mother, my grandmother, had experienced breast cancer twice, the diagnosis still came as a shock. Yes, she had breast cancer, and yes, she had HER2-positive disease, and yes, despite undergoing aggressive surgery, chemotherapy, radiation, and more chemo, she died 14 months from her diagnosis. Nothing worked. I recall sitting on the floor of my medical school library on a payphone, desperately trying to get through to a representative at Genentech, the company developing the drug which came to be known as Herceptin, to see if she qualified for compassionate use of that drug. She died 2 weeks after that call. So yes, I often think, what if? Had she only developed her cancer 10 years later, would she have met my husband? Would she be able to spoil my children? Would she be proud of how I spent my career and the woman I've become? As I stared down at the letter, the tear that formed in my eye was one of joy, knowing that the answer was yes. Through tremendous pain, there was hope and light and life that was born out of a career that enabled me to touch the lives of others. I now counsel women about the gift genetic testing can offer in clarifying cancer risk in the family. We can now prevent and treat cancers like she had. Though this knowledge won't bring her back, I felt that light, her light, through an unexpected package with a typed card.